Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! Welcome back to my channel. In this video, I will continue the pharmacy career series where I talk about different pharmacy career paths. In this video, we will learn about the role of the ED pharmacist. Make sure to check out the other videos also. I will include the links down below. So the emergency department is a very complex environment. Reasons being because a lot of patients with acute conditions where it could be any type of condition, right? They come in there and it's a fast-paced workflow, and majority of these patients are getting very high-risk medications such as vasopressors or even IV antihypertensives. Now, the challenge for medication selection, dosing, administration, and monitoring comes to light because, like I said, you're high-risk patients getting high-risk medications. So it's very important that the right medications are selected, the dosing and the administration, and also monitoring are all done properly. So as we all know, the emergency department is very time sensitive, right? So that's where patients may get their first antibiotic, or a patient may come in with a stroke. These patients need to be managed right away. Now, the emergency department clinical pharmacist specialty is kind of new compared to the other specialties like AmCare, infectious diseases, oncology. But what you will see is that from 2007 till 2020, there has been a 2,000% increase in the residency programs. So in 2007, there was only 3 programs. And then in 2020, there's 70 total programs. And it's mainly due to published research bringing light to the benefit of having a ED pharmacist on board, and acknowledgments from physician national organizations such as the American College of Emergency Physicians, where they stated on their website that they believe that pharmacists serve a critical role in ensuring efficient, safe, and effective medication use in the ED, and advocates for health systems to support dedicated roles for pharmacists within the emergency department. Let's take a look at some of the roles of the emergency department pharmacists that makes them so valuable. So the first one is patient education. Now, these patients are coming to the emergency department and they're usually in acute conditions, right? So when you're leaving, patient education is even more important because they may be so traumatized or whatever from the thing that brought them to the ED that when you're going home, they may not focus too much on like the information that's provided to them. So it's very important to counsel these patients effectively. They counsel patients on discharge medications, and this can also include the patient's caregivers. Next, their drug information specialist. This is a fast-paced department, so they need quick answers sometimes, right? They don't have the time to go look up every single thing. So as a pharmacist, that's where you become more valuable because you are the drug information specialist. And I love the fact that pharmacists get to exercise this skill even more in the emergency room simply because it keeps you on the tip of your toes, right? You always want to stay up to date. You always want to make sure you know the important information, and that can definitely go a long way. Next, resuscitation. So clinical pharmacists in the emergency department do participate in codes. So whether they're preparing medications or providing clinical advice to the physicians. Transitions of care. So when the patient comes into the emergency department, some of them get admitted to the regular units, right? So for the clinical pharmacists, they coordinate this whole transition, make sure that the patient's medication are taken with the patient if needed, communicate with the physicians on the unit to let them know that, oh, this patient just got this medication. So this is one of my favorite roles of the emergency department clinical pharmacist because with all the chaos going on in the emergency department, sometimes things go missing. So I love the fact that there's a pharmacist there to make sure that everything is okay. Ensuring timely delivery of medications. So for example, with antibiotics or medications for a stroke or a bleed, right? Like antidotes. So, the clinical pharmacist will coordinate with the pharmacy technicians or the other pharmacy staff to make sure that the medications are delivered at a timely fashion. Perform medication reconciliation. So when the patients come into the ED, you want to update your medication list, right? Especially if you're getting admitted. Most of the times when a patient is getting admitted, they may be started on their home medications, right? So if the patient has certain medications that they're actually not taking anymore, we don't want the inpatient team to restart that patient on that home medication. And it's also good for drug interactions, right? So after doing the med recon, let's say the pharmacist finds out the patient is taking a medication that, even if it's a supplement, right, that causes a lot of drug interactions with some of the medications that the patient may potentially get once admitted. Compounded medications. So they compound medications as needed for codes, medications that have short stability that can't be compounded by the inpatient pharmacy. And if the patient cannot wait, right, because the situation is so severe that the medication has to be made on the spot to be given to the patient right away. Managed medication inventory. Hands down, my second favorite role of the ED clinical pharmacist. You want to make sure that the important medications are in the PICSs in important places in the emergency department, right? So some parts of the emergency department may have more of this medication compared to another part. So this is something that the clinical pharmacist must determine by communicating with nurses and also physicians. Medication verification. Now, this is usually the job of the staff pharmacist, but sometimes as a clinical pharmacist, you may want to verify medications also, just because of the urgency of that scenario. Monitor patients receiving high alert medications, IV antihypertensives, vancomycin, right, aminoglycosides, anticoagulants, thrombolytics, etc. The clinical pharmacist monitors these patients because some of these medications may require titrations. So the clinical pharmacist can coordinate and communicate with the nurses regarding the appropriate titrations, drug level monitoring if needed, discontinuation, etc. How to become an ED clinical pharmacist. Of course, you graduate, you do a PGY1 residency in general pharmacy, then you do a PGY2 in emergency medicine, and there's currently 77 programs. Sometimes, depending on the institution, if you completed a PGY1 residency with a lot of training in emergency department pharmacy, then of course you may have the opportunity of becoming an emergency department clinical pharmacist without actually doing the PGY2. So that depends on how well you're able to sell yourself. It also depends on your training in PGY1 residency, like I had mentioned. And also if you have several years of practice experience in the emergency room. So like I said, this pharmacy specialty is still in its early phases compared to the others. I mean, they don't even have a board pharmacy specialty exam yet. Last year, they actually appointed 9 members to join the special council. And one of the main functions of these members is to develop the BPS exam. So they're anticipating the first exam to be scheduled for 2022, I believe, in the fall. And that will be the end of this video. I hope I was able to give you the general roles of the emergency department clinical pharmacist and also outline the importance of having them in the emergency department and how valuable they are and how they've been recognized by other physician organizations. Now, if this video was helpful, make sure to like, comment, subscribe, and share the video with anybody that could benefit from it. Connect with me on these social media platforms. Thank you for watching this video and take care.